but we're going to talk to virologist Dr. Elisabetta Grappelli. First up, though, Chief Executive of the NHS Confederation, Niall Dickson, joins us. Good morning to you once again, Neil.
Good morning.
Again, since last Thursday, and we had that last press conference with the Prime Minister alongside, flanked by the Chief Medical Officer, Professor Chris Whitty, and the Chief Scientific Advisor, Sir Patrick Vallance, things seem to have moved on. In particular, this Public Health England document, which The Guardian claims is basically saying that what was being predicted by Chris Whitty last week as a worst-case scenario is actually what is, in the words of the document, expected to happen. And this is 80% of the population expected to be infected with COVID-19 in the next 12 months, and 15% of those, that's 7.9 million people, may require hospitalisation. Those figures are enormous. If that is the case, can the NHS cope?
We certainly couldn't cope if they all happened at once. I think, and even over a long period, that would be a massive draw on the National Health Service. I think the aim of the government strategy is relatively clear, which is there is a sort of acceptance, which I don't think is quite in the public mind yet. I think there's a sort of acceptance that this virus is going to come and it's going to affect large numbers of people, whether we like it or we don't. And the strategy is to try and extend it over as long a period as possible. And that is why they are taking actions that may seem different from some other countries, because their argument is that if you lock the over 70s up, as it were, for a very long period, the shorter that period, the better, but you may have to do it for a prolonged period if you're going to protect the NHS and not have very large numbers of people who require treatment at any one time. Now, you started to hear other scientists begin to sort of challenge this. I think the key for us working and all my members working in the NHS is certainly all the contingency plans are being put in place. The idea of, I think the word is several-fold, increase the capacity of things like intensive care. Certainly the government should be trying to get as many extra ventilators and so forth as possible, and protecting our staff, making sure that we get all the additional army of people who could help out in hospitals ready, and indeed in the community as well. So those kind of things we simply just have to get on with. I think the plea to the government would be, well, just be as transparent as possible. If people are arguing about this approach or that approach, I think everybody should accept that although this is science, it is quite new, and this modelling and all the rest of it, I believe we've got some of the best public health people in Public Health England and in the government that anywhere in the world. I have quite a lot of faith in them, but the key point is we demonstrate where there is difference, and we show as transparently as possible why we're taking the decisions we're taking.
Well, this is it. I mean, again, I do think daily press conferences will be rather crucial on that, but I would say I was certainly very persuaded by what Chris Whitty and Patrick Vallance had to say last Thursday, the explanation for why we were doing things differently from other EU countries. And the main argument, it does seem to be that actually a lot of these very big gestures, lock down the country, close the schools, don't actually have any real effect in terms of the number of people who catch the virus and you end up getting ill, but they do have a massive effect on people's lives and on the economy, and therefore that it's a very, very poor trade-off just to be appearing to do something. And this whole idea that, again, that's very strange, this squashing of the sombrero, if you see these graphs that show, want to make sure, look, the same number of people are going to get infected, but the idea is that they get infected over a slower period of time so the NHS can cope. Are you confident the NHS can cope, though? Because we're told, I think people were stunned to discover yesterday from Matthew Hancock, the Health Secretary, we only got 5,000 ventilators in this country. Last week, Germany bought 10,000. We're now saying, Rolls-Royce, JCB, any chance of making us some ventilators? We've known since early January this was coming. Why was the NHS not buying up every ventilator on the planet?
Well, I think it's a very good question. I simply don't know. I do know that, first of all, it is partly about ventilators. It's also about things like using oxygen pipes and so forth, which is why they're talking about converting theatres and so forth. But I agree with you. It looks as if we should have done that earlier, but I don't know. I haven't heard the reasoning why we're now taking that decision to try and get manufacturers to start making these things. It's clear that this virus for the very ill. We talk about intensive care, but it does seem that ventilation or giving people oxygen seems to be the key intervention. So it doesn't necessarily require all the paraphernalia of intensive care, nor can it simply mean the kind of staffing ratios you have in intensive care, which is 1-to-1 nursing.
Yeah.
That simply won't be possible. And even high dependency, which is 1 nurse for 2 patients, is obviously going to be, I think, very difficult. But it should be possible to expand. And certainly the figure I was given was that they should be able to expand the intensive care capacity several-fold. So, but that, again, compared with the kind of numbers that you were talking about, that would be very difficult, because the actual number of people who became very ill and required that, if it happened in a concentrated period, would be very difficult. For any health system, frankly, too.
Well, this is it. Everyone's saying any health system, but we know, the Italian health system, the French health system, the German health system, they are better than us. They have better outcomes for heart disease, for cancer, for the like. They have more beds, more staff, more critical care beds than we have per head of the population by a long way. Germany by a factor of 4, for goodness sake. It is no doubt, is it, that people are going to die in this country because we haven't invested enough in the NHS in recent years, or over decades, if people are going to quibble about that, whatever the time. If we had spent more on our NHS, more people would live.
I would say we should have spent more than we have. At this point, I wouldn't want to predict exactly what is going to happen as a result of this virus. And I think that people who make either alarmist or, frankly, very comforting comment about what is going to happen really don't know. And I think the better thing to concentrate now on is, I'm sure we can have the fisticuffs about, did we have enough and did we act quickly enough back then afterwards. But for now, I think the thing that most NHS staff need is all the support that they can get, both in terms of equipment and very clear instructions from the centre. I think that is beginning to happen, and I think there are very good contingency plans which are going on and are being put in place by our members. As I think I said to you the last time, one of our members made the very obvious point: this is a marathon, not a sprint, and everybody's treating it like a sprint. It isn't, and therefore there's planning and testing going on this week, scenario planning. So if we had that number of cases at one time, how do we manage that? What leave do we cancel? What extra shifts do we give to?
There's going to be a lot of ramping up of things this week, isn't there? Niall Dickson, we'll leave it there. Chief Executive of the NHS Confederation, really appreciate you taking the time and hearing your expertise there. 8:14 is the time. Let's turn our attention to the actual, the medical knowledge on this. Dr. Elisabetta Grappelli is a virologist and lecturer in global health at St George's University in London. Good morning to you.
Good morning.
Good morning. There's been a lot of controversy over this week and a lot of concern